Perfect. Welcome. This is the very first episode of my new series called Briefly in Depth. My name is Barrington. I'm here with the wonderful, illustrious Dr. Ebby Bobmanuel, one of my biggest supporters, a great friend of mine, and a dear brother. Okay? Today we're going to go over what he does in his life as a professional doctor, what he likes, what he doesn't like, and where he is now.
Yes, sir.
Thank you for joining me
Appreciate
today.
you.
Thank you,
Appreciate
thank you,
you.
thank you, thank
Yes,
you.
sir.
So, first, what is it that you do? What kind of medicine do you practice?
Okay. It's a mouthful, but I know it's a mouthful, but I'm an interventional and endovascular cardiologist. So
Okay.
what that means is that I take care of people's hearts.
Okay.
If people have blockages in their arteries in their hearts or in their legs, I'm able to go in there, find the blockage, and fix it either with a balloon or a stent and open the blockage. A blockage in the heart generally is a heart attack, so it's usually serious or life threatening,
Yes.
and we have to go in there and right away open up that blockage to stop the heart attack. In the leg, it can cause something called peripheral vascular disease or venous disease, and we go in there and open up those blockages so they don't lose their legs from ulcers or wounds or so on and so forth. But in a nutshell, that's what we do. I kind of think of myself like a plumber. So yeah, so I'm a plumber. I use a rotor rooter, and when I find something is clogged up,
Yes.
I go in and I clean out the blockage.
What is the most interesting part of your job?
Huh. That's a loaded question. I mean, it's an interesting job. I mean, but I think the most interesting part is that we can take people from almost checking out to staying on this earth. And that's very humbling. You know, people are getting younger and younger with heart attacks. And we can take that 50-year-old guy with a wife and two, three kids at the top of his game, just got a new house, a second car,
Yeah.
wife doing good, kids just started college. And instead of him just checking out, by the grace of God, we can give him a second chance to live till 75 instead of checking out at 50. And so I would say the dramatic, immediate improvement um, for those who are lucky and blessed to come early enough. I would say that's the most interesting part. And just to be part of that is a blessing. Just to be able to take them from that point of almost checking out
Yes.
to staying on this earth. Yes, sir.
That's beautiful.
It's humbling.
Can I ask you, where are you from originally?
I'm from Nigeria. It's funny people ask me where I'm from originally. That's an American thing. I'm only from one place.
True.
Yeah, but yeah, no, I'm from Nigeria. I was born in Nigeria, and I spent the first 17 years of my life in Nigeria before I moved to Europe and then here.
How was that transition coming from Nigeria to Europe to America?
Um, it was hard. It was different. When I 17, you love the warm weather in Africa and Nigeria, and just being home. And then all of a sudden, you're thrown into Eastern Europe. You have to learn a new language, and when you're 17, everything is fun. So I just had fun. And I learned the language. I speak Hungarian. I went to school there. I did my college there, my med school there, and then I came here. So, I would say I have enjoyed the journey. I have enjoyed. It's funny because I'm still young, but I feel like I've been on a journey.
You've done so much.
Exactly, but I've enjoyed the journey, and it's not the usual journey of being home. I will tell you, I wonder what it feels like to have spent my 20 and 30s where I'm from. I didn't get that chance. Like I said, I left home at 17, but I've enjoyed living on three continents.
Now let's go back.
That's right. And I do go back. Not as much as I want to, but yeah.
I got you. Okay, next question for you. So when you said you did medical school over in Europe or in
I did
Africa,
in Europe, yeah.
how did those credentials transfer over into America?
Um, you know, it's fairly straightforward. We write this, board exams called the USMLE, and obviously you get the kind of the foreign equivalent certificate, and then you can apply for your residency training and fellowship training, which I did all my postgraduate training here in the US. So I trained for from 2015, 20, 14, 15. From 2015 until 2022. So I trained for about 8 years post medical school here in the US. So yeah, but to qualify to do those training, I had to write those board exams. I had to write 4 exams, and then obviously my European degree was accepted, and I came over.
Good stuff.
Yeah.
So for anybody following in your footsteps that would come from Africa to where America we
Right.
are in America,
Yeah.
what would you advise them? What's some tips, tricks, pitfalls that you had that you would want somebody else to avoid?
Well, that's a whole episode on its own. So I don't want
Just
to.
a couple quick things.
Yeah, it's a whole episode. I don't want to drag this on, but I would say one. I mean, you got to plan. You got to plan. You can't just go into to write the exam.
Mhm.
You got to ask for advice. You can't go into the exam, get a low score, and then come ask me for advice on the back end. You got to ask before that.
Yes.
You got to have a plan. You have a timeline. You don't want to read for a year for an exam. A couple months, 4 months. Everyone is different, but 4 or 5 months. You want to be prepared, because if you pass with a low score, you're stuck with a low score. You can't improve your score.
Mhm.
So, look in the camera moment. Call me before the exam, not after the exam.
Call them.
Right. Before the exam, not after the exam. But on a more serious note, you know, you got to strategize. You got to strategize from the beginning. I mean, you're in med school, so you should be used to that. And so you want to ask for advice. You want to, go online, look at your resources. You want to use the question banks. Like I said, I don't want to make this an episode about the exams, but you want to make sure you're doing your question banks, you're doing the video lectures, and you want to talk to people that are already there. That's the most critical step.
There you go.
So you have the foreign doctors who are already working in the US. I mean, there's a process. I know right now things are even harder, but you don't want to go this alone. Reddit is not enough. You want to talk to actual human beings before you go.
Don't chat GPT.
Exactly. That's not enough. All right.
Okay, next question for you. How many doctors are in the greater Memphis area that do what you do?
So that's a good question. I mean, my group, we're probably 12, 14 in my group, and in other groups, maybe another 10. So I would say, generally speaking, now not all that I do, but the interventional cardiology part, somewhere around 25 to 30 people in Memphis do it. The endovascular part, maybe another 10 do that part. So I'm one of 10 in that aspect. So altogether, we're probably roughly about 40 of us in the whole Memphis that do exactly what I do.
The reason why I was asking is
Yeah.
because do you think that you guys have enough coverage for the whole city, or are you guys understaffed?
We're always understaffed. I mean, we're always understaffed. And, so we cover, with my group, we cover the tri state area. We cover West Memphis, Arkansas. We cover northern Mississippi. So Oxford, anywhere above Oxford, we cover. We see patients as far as Tupelo, Cleveland, Mississippi. We see patients from Tipton County. So that's
Pretty
Brighton.
far up,
Oh
yeah.
yeah, oh yeah. No, that a lot of my patients come from Montford, Brighton, Tennessee, Arlington, Crittenden, which is Arkansas, and then obviously we see basically everyone who's west of Jackson, Tennessee. We also see those people, not east but west. So from Jackson has a lot of coverage, but anything west of Jackson, we see them.
Okay.
And then obviously the whole of Memphis. So it ends up being a very large catchment area. Memphis is 600,000, but when I just added all the places I mentioned,
a lot more.
it's now over 1 million. So because of that, we are short-staffed. Not just because of Memphis, but because all these rural areas around Memphis, they don't have those facilities. So everyone is flown in here if they're in a bind.
So if you need a job and you are an interventional cardiologist,
Oh yeah.
come to the city, come support us.
Oh yeah, absolutely. There's no lack of jobs.
There you go.
Yeah,
there
the
you
barbecue is a job security, but yeah.
A few more questions.
Yeah.
What makes a good doctor in your professional opinion?
That's one to reflect on because first you have to listen. Um, you have to go in the room. You have to sit down, and you have to listen to your patient. Um, Sometimes we get too busy in the jet age, and everyone is running and ripping. Even if you have 5 minutes to just shut up and listen, it goes a long way. When I go in the room, I kind of chat a little bit, try and find something in common with the patient, so help them relax, and so we can talk about sports or
Some
whatever,
icebreakers. Yeah.
icebreakers, and it's different. My patients come in all shapes and sizes and backgrounds, so I find something to connect with them on some level, and I just ask them an open-ended question: What's going on? Why are you here? And I know why they're here because I've read about them, but I want to hear their own words. And so a lot of people.
Sorry, they're bigger than a piece of paper.
Oh,
They're not just they're
absolutely,
not just a piece of paper
absolutely,
or a rap sheet.
and that's the most important thing. I mean, uh, other things that are important are, um, you know, being receptive to your patient's suggestion, as long as it's not crazy. I work with my patients. Okay, they can't do this. Okay, well, let's try and do this.
Mm-hmm.
I'm not closed-minded. Human beings are not cars. So when someone tells me, doc, I still have this pain. I validate that. I validate it. I may have done a stress test that's negative. I'm like, I've got a CAT scan.
It could be mental, it could be physical, it
It
could be
could be.
spiritual, it could be emotional,
It
it
could
could
be.
be.
So I come with this understanding. It's a reason why people drive 2 hours to come to my office. They don't just have gas or they're not bored. There's ice on the ground, and people are driving 2 hours to come see me. There's a reason for that, and so I take that. That's a lot of respect and trust and hope. In this weather, in this economy, they're gonna come pay a copay and drive for 2 hours to see me. I want to help them. I want to help him, and if I can't help him, I don't want to hurt him.
Thank you. Okay. Let's see. Last question for you. Out of all of the other doctors that you work with and that you know in the city that do similar to what you do, what makes you different? Why should somebody come to you versus everyone else?
First of all, I can't see everyone, so I have a lot of great partners who I would personally recommend. I would let them take care of my parents. So they are great interventional cardiologists or endovascular specialists in the city of Memphis. Who are some of them are my colleagues, some of them are not in my group, but also great. So I would say we have a lot of good doctors. What would make me a good choice for a patient who had chest pain or shortness of breath or swelling in their legs or ulcers in their feet. If they have coronary disease, peripheral vascular disease, I'll tell you number one, I'm going to listen to you. I'm going to listen to you and I'm going to take care of you regardless of who you are, where you're from, what you look like. I don't care about any of that. I'm going to take care of you. And the same way I'm going to take care of my own dad or mom. And I'm going to do a good job. I'm well trained by the grace of God. I have a great team I work with. I have the resources in my group. And you're not gonna be just another bean counter. You're not gonna be just another dollar. We're gonna try and help you. And like I always tell my patients, you know, I'm not in this because I'm trying to get rich. I could have done many other things that are a little bit easier, but I truly have the passion to help people, and it would be my honor um, to help you as your doctor.
Thank you. Very last thing. Would you like to shout out your black men in white coats?
Oh yeah. Black Men in White Coats has been a great group and a great um, union of black professionals, really across the U.S. But our group here in Memphis has been very successful. We have over 70 members, and it's open to all all specialties in the healthcare field: nurses, pharmacists, nurse practitioners, physical therapists, occupational therapists, lab specialists, doctors, whatever,
So it's a
dentists.
brotherhood, basically.
Absolutely.
Okay.
Great brotherhood. And we welcome everybody. But, we welcome everybody. But obviously it's centered around black men in the field because and the reason is we don't have enough of that. We
The
don't have enough.
support.
We don't have that. We always say there were more black men in medical school in 1978 than there are today. Exactly. That's rough. It's gonna be 50 years in 2028. So there you go.
That's
So so there's a problem,
Yes.
and so we know that through mentorship and through resources, we can increase that number. Not by letting anyone into medical school who doesn't deserve to be there. We're not in the business of that. No one is doing that. No one is helping anybody get into med school if they didn't pass their exams. That's silly. The students who we're helping, they've passed all their exams, but they don't have the resources. They may not have the money. They may have to take two jobs. They may,
They put in the work.
yeah, but they've put in the work. They've passed their board, so no one is giving them a free ride. That's not what Black Men in White Coats is about. It's about mentorship. We notice a lot of the inner city students, or a lot of the underserved students, or even rural students. No one in their family is doctors. They've never had a doctor. A lot of people who we mentored, we noticed that we were the first doctors that they saw that were of color. So they went their whole life basically they never met a black doctor, and so and these folks are 25. How you go 25 years?
I've never seen a black doctor.
Exactly.
That's really crazy.
So that's what is going. So that's what we're trying to change. We're not in the business of handing out admissions into med school. That's crazy talk. We are saying there are people who have done the work, have passed their exams, but still do not have the resources or the mentorship. They don't have anyone to ask those questions. They don't have anyone to shadow. They have passed their exams, but they can't find a doctor who will agree to let them shadow them in the hospital. Well, we're saying that we're going to help everybody and anybody, especially those underserved students who do not have access to those resources. So, yeah.
Thank you so much.
Absolutely.
Very last thing. Where can they find you? If somebody wants help, a patient wants help, where can they find you at?
Well, you can find me on LinkedIn. You can find me on the Stern website by just Googling Dr. Bobmanuel, Cardiology, Memphis, or checking Stern Cardiovascular, Dr. Bob on Stern Cardiovascular. You can call our number on 901-271-1000. Make an appointment to see me, or just click my face on the website.
Pretty face.
Yeah. Shouldn't be too hard to find me, and then just make an appointment there. I will take it from there.
Perfect. Thank you,
I
man.
appreciate that. Thank you for the opportunity.
My name is Barrington. This is Dr. Bob. Briefly in depth. Thank you guys so much.
Thank you.
Thank you, man.
Thank you. Appreciate you.
I'll let you get back to it.
Yeah, that's send me like when you caught it up.
I will.